We are living longer than ever before. Thanks to medical science, we're conquering diseases that would have been fatal even just a few decades ago. We're finding new ways to improve our quality of life as we age. But there's still one thing that's going to get all of us, and that is the effects of aging. If you're a senior or you care for someone who is, then this video is for you. We'll explore the many ways that walking can benefit seniors over 80, including improved balance control, lower risk of falls, increased muscle strength, and much more. Studies have shown that regular walking can help improve balance control, which is important for preventing falls in older adults. Studies have shown that regular walking can help lower blood pressure in older adults. A study published in the Journal of Hypertension found that participants who walked for 30 minutes a day. Studies have shown that regular walking can help increase muscle strength, particularly in the lower body. Cognitive decline and dementia are common concerns among older adults, and they can have a devastating impact on individuals and their families. Studies have shown that regular walking can help boost the immune system in older adults. A study published in the Journal of the American College of Nutrition found that participants who walked for 30 minutes a day 5 days a week had higher levels of immune cells, which are responsible for fighting off infections and diseases compared to those who were sedentary. Another study published in the International Journal of Immunopathology and Pharmacology found that walking for 10,000 steps a day was associated with lower rates of upper respiratory tract infections in older adults. This is likely because walking helps improve circulation and promotes the production of immune cells, which can help strengthen the immune system over time. In addition, walking can help reduce stress and improve overall health, which can also help boost the immune system. Studies have shown that regular walking can help maintain cognitive function and reduce the risk of dementia in older adults. Cancer is a leading cause of death among older adults, but studies have shown that regular walking can help reduce the risk of certain types of cancer, from improved balance control to a reduced risk of cognitive decline. Walking can help maintain overall health and well-being as we age. If you're a senior or you care for someone who is, consider incorporating walking into your daily routine. Start with just 10 minutes a day and work your way up to 30 minutes. Be sure to consult with a healthcare professional before starting any new exercise program. Thank you for watching. A study published in the American Journal of Clinical Nutrition found that participants who walked for 30 minutes a day, 5 days a week, had lower levels of certain cancer-related proteins in their blood compared to those who were sedentary. Another study published in the International Journal of Cancer found that walking for 10,000 steps a day was associated with a lower risk of developing colon cancer. This is likely because walking helps improve overall health and strengthens the immune system, which can help reduce the risk of cancer development. In addition, walking can help maintain a healthy weight, which is also important for reducing the risk of certain types of cancer. A study published in the journal Neurology found that participants who walked for 30 minutes a day, 5 days a week, had slower rates of cognitive decline compared to those who were sedentary. Another study published in the same journal found that walking for 10,000 steps a day was associated with lower risk of dementia and cognitive impairment in older adults. This is likely because walking helps improve blood flow to the brain, which can help maintain cognitive function and reduce the risk of cognitive decline. In addition, walking can help stimulate the production of brain-derived neurotrophic factor, which is a protein that promotes the growth and survival of brain cells, which is also important for maintaining cognitive health. A study published in the Journal of Physical Activity and Health found that participants who walked for 30 minutes a day, 5 days a week for 8 weeks had increased quadriceps muscle strength compared to those who did not walk. Another study published in the Journal of the American Geriatric Society found that walking for 40 minutes a day, 3 days a week for 12 weeks was effective in increasing leg muscle strength and improving functional performance in older adults. This is likely because walking requires us to constantly engage our leg muscles to propel ourselves forward, which helps build strength and endurance over time. In addition, walking can help improve blood flow to the muscles, which can help promote muscle growth and repair. 5 days a week for 8 weeks had a significant reduction in both systolic and diastolic blood pressure compared to those who did not walk. Another study published in the Annals of Behavioral Medicine found that walking for 10,000 steps a day was associated with lower blood pressure in older adults. This is likely because walking helps improve blood flow, which can help lower blood pressure. In addition, walking can help reduce stress and improve overall cardiovascular health, which is also important for maintaining healthy blood pressure levels. A study published in the Journal of Gerontology found that participants who walked for 30 minutes a day, 3 days a week for 12 weeks, had improved balance, control, and coordination compared to those who did not walk. Studies have shown that regular walking can help improve sleep quality in older adults. A study published in the journal BMJ found that participants who walked for 60 minutes a day had better sleep quality and spent less time awake at night compared to those who were sedentary. Another study published in the Journal of Clinical Sleep Medicine found that walking for 30 minutes a day, 7 days a week for 4 weeks, was effective in improving sleep quality and reducing insomnia symptoms in older adults. This is likely because walking helps promote relaxation and reduces stress, which can make it easier to fall asleep and stay asleep. In addition, walking can help regulate our circadian rhythm, which is our internal body clock, which is also important for maintaining a healthy sleep cycle. Another study published in the Journal of the American Geriatric Society found that walking in a park with uneven terrain was effective in improving balance control and reducing the risk of falls in older adults. This is likely because walking requires us to constantly adjust our balance to maintain stability, which helps strengthen the muscles and improve our reaction time. In addition, walking can help improve our proprioception, which is our sense of body position and movement, which is also important for maintaining balance. So if you're ready to learn more about the benefits of walking for seniors, let's get started. As we age, our bodies start to change in big and small ways. As we age, it's common for us to become less active, which can lead to weight gain. Studies have shown that regular walking can help maintain a healthy weight, which is important for overall health and well-being, especially in older adults. One study published in the Journal of the American Medical Directors Association found that participants who walked for 30 minutes a day, 5 days a week, were able to maintain a healthy weight and reduce their risk of developing chronic conditions such as heart disease and diabetes. Another study published in the British Journal of Sports Medicine found that walking for 10,000 steps a day was associated with a lower body mass index, which is a measure of body fat based on height and weight. This is likely because walking burns calories and helps maintain a healthy metabolism, which is essential for weight management. In addition, walking can help reduce appetite and promote a feeling of fullness, which can lead to reduced calorie intake. Our muscles and bones weaken, our metabolism slows down, and our risk for certain chronic conditions increases. It can be hard to keep up with the changes our bodies go through as we age, but there are some things that we can do to help ease the transition. One of those things is walking. In this video, we're going to take a look at how walking benefits seniors over 80. Let's begin with the most obvious benefit of walking, exercise in general, and that is weight management. Next is improved balance control. As we age, our risk of falls increases, which can lead to serious injuries and decreased independence. Moving on to low blood pressure. High blood pressure is a common issue among older adults. It can increase the risk of heart disease, stroke, and other chronic conditions. Another benefit of walking is improved sleep quality. Sleep disturbances are common among older adults, and they can contribute to a number of physical and cognitive problems. Next is increased muscle strength. As we age, it's common for us to lose muscle mass and strength, which can lead to decreased mobility and independence. The next benefit of walking is decreased risk of cognitive decline. Another benefit of walking is an increased immune system. As we age, our immune systems become weaker, which can make us more susceptible to illness and infections. And finally, another great benefit of walking is reduced risk of cancer. As you can see, there are many benefits to walking for seniors over 80.